Active movement is performed by your partner. He actively moves his body while you palpate or observe the movement. For example, the text may say, ask your partner to slowly flex his elbow while you palpate his biceps brachii muscle.
So go ahead, flex your elbow. Extend. Flex. Extend. Flex. Extend.
All active movements performed by your partner should be slow and smooth, as changes in tissue are difficult to follow during fast, jerky motions. Sometimes you might be instructed to ask your partner to contract and relax the muscle. For example, to feel the forearm flexors, lay your hand on your partner's forearm and ask him to alternately flex and relax his wrist.
Flex your wrist and extend, flex, extend, flex, extend.
The on and off aspect of this technique will not only help you locate muscles and tendons, but will also give you the opportunity to feel the difference between contracted and relaxed tissue.